The drive home on News Talk 710 KURV, Roxanne Flores and Davis Rankin. Also joining us today is Dr. Ken Redcross, author of Bond, the Four Cornerstones of a Lasting and Caring Relationship with Your Doctor. We talked about this briefly last week or 2 weeks ago, Davis, about vitamin D. Dr. Redcross says vitamin D as in dog, has been the spotlight during 2020 because of how it reduces COVID symptoms and deaths. So our guest, Dr. Redcross, thank you so much for joining us. We really appreciate it. Mm-hmm. Tell us more about vitamin D deficiency and how it affects or impacts COVID-19 patients.
Thank you very much, guys, for having me on today. This is exciting because, for years we've talked a lot about vitamin C and what vitamin C does, but vitamin D now has kind of taken the forefront because we're also understanding how important vitamin D is for our immune system, everyone. So as you're hearing a lot in the news, you'll hear about D when it comes to the coronavirus. It does not treat the coronavirus. The way it really makes a difference is what it does for our immune systems. In fact, almost every particular immune system cell that we have has a receptor for vitamin D, which really underscores how important it really is for our immune system.
I read somewhere, Dr. Redcross, that a majority of Americans are actually vitamin D deficient. Is that true? And if so, why is that? Do we just hate going outside?
No, it depends on where you're located. I'll tell you, but yeah, as we do these studies and we learn more, about 90% of us are vitamin D deficient. Why is that? Well, two reasons. Number one, our diet is not particularly rich in vitamin D. Everyone will mention milk or creams and that sort of thing, but don't forget that it's fortified with vitamin D. It's added. And then you have people like me who I'm out in the Northeast. I am in New York, everyone. And so we are dealing with this weather. We don't get the sun as much up here. So therefore, we're not converting it into our skin or through our skin. And last but not least, if you have more melanin in your skin, whether you're an African-American or Latino, the difference is that it's a little bit harder for you to convert the sun's rays to get vitamin D. So there's a lot of different things that play a part. Older people don't get out as much as well. They're in homes. Those in assisted living facilities. So as you start to understand these stories, you start to understand why the coronavirus is playing such a big part, and we're learning so much about why vitamin D really needs to be checked, and we need to all know what our levels are.
This is Davis Rankin. Why is it, or how significant is the resistance to uptake of vitamin D amongst, is it just typically darker skinned people?
It is. And Davis, it's a great question. How significant is it? Well, number one deficiency in the United States are African Americans, followed by Latinos second. About 80 to 85% of African Americans, and some studies even show higher, that do not convert vitamin D levels well. So what really is the important thing? Well, the important thing is to make sure that we're getting our levels checked. How do we do that? Because right now it's not so easy to get into your doctor. At least here in New York and in the Northeast, it's a little bit of a challenge. So there's two ways. If you can't get into your doctor, you can go to a website called thepowerofd.org. I mentioned this one, guys, because there you can actually go to that site, thepowerofd.org, and order an at-home test kit. So it's sent home, it's a finger stick, you send it back in, and you get the results. And that's something that's making people's lives a lot easier, but it's that important to really know what are our levels and where we're going to get them to. The sweet spot really is between 40 and 60, where you want to get your levels up to.
You mentioned that because of people's skin tone, that it also affects, I guess, their vitamin D levels. Does that play a part as to why we're hearing that a lot of Latinos and African Americans are experiencing COVID at a higher rate? Would that play a part?
Exactly, and that's exactly what we're learning more about in the medical community to really put the pieces of the puzzle together. For instance, if you look in the Hispanic and the African-American community, you look at 4 disease states in particular that are more rampant, such as heart disease, lung disease, diabetes, obesity. All of those disease states, even without the coronavirus, are associated with vitamin D deficiency as well. So it's almost like a quadruple whammy, if you will, when you think about that. And you also think about those who are in the inner cities or don't have as much wealth and so forth, where social distancing really is a luxury. And that's a big issue, obviously, with the coronavirus.
Joining us on News Talk 710 KURV is Dr. Redcross, author of Bond, the Four Cornerstones of a Lasting and Caring Relationship with Your Doctor, talking about how vitamin D deficiency is playing a big role in COVID-19. Go ahead, Davis.
Natural sources of vitamin D, what are they, and how rich are they in vitamin D?
Yeah, great question, David. So the best sources are usually fatty fish. In fact, it was fatty fish livers. I actually get a good amount of vitamin D.
That sounds gross.
I pretty much. I don't think you could dress that up any better. I agree. But I'm a sardine fan, so if you get sardines, you can get some in. But look, let's face facts. You're not getting enough, really, to battle the virus that we're dealing with and just for our immune systems in general. So usually there's not many things that are really rich in vitamin D. But once again, fatty fish livers are a good source to try to get that. But once again, for the most part, you have to supplement with vitamin D. And so, the supplements are over the counter, but you want to make sure you have one that has several key cofactors in there as well.
And because I take a vitamin D, I think 10,000 is it international units based on my doctor's recommendation. Wow. And I've been bumping it to 20 and sometimes 30.
No. Okay. Well, I'll tell you this. Well, Davis, your doctor is where he's preaching to the converted. Because I also take 10,000 international units. Let's just be careful to check your levels here and there. It's a blessing. God's grace. Our body usually, if we're getting too much vitamin D, it can shift it into an inactive state. So therefore, you're not going to necessarily absorb it. So that's a really cool mechanism. But you want to check your levels. Usually I get up to 10,000, not much more than that, because that keeps me in that level between 40 and 60. In fact, my vitamin D levels, everyone, runs about 65 to 70. But I, too, did that test that I mentioned at thepowerofd.org to check for myself. And I usually do that every 6 months.
Well, you can do your own blood test, though. We have to pay to have it done. Actually, doesn't cost that much if you go to a cash place.
But one thing I want to kind of bring up is I wish more doctors were out there saying, go out there and exercise. Can doctors prescribe? Can they prescribe walking? Can they tell people to go outside at least for
getting them to
20 minutes a day?
Well, you know what? That's a funny joke, guys, because on my prescription pad, I don't like to use my prescription pad at all. I'm not a fan of medications if we don't need them. I'm a little bit more closer to the earth when it comes to managing, but I will write on a prescription exercise. And I'll tell them how many days a week to do it and how long to do it. So you're right. That's such a big part of us staying healthy and staying well, in addition to making sure our vitamin D levels are up and that we are, in fact, checking our levels.
Yeah, that's very true. Before we go, Dr. Redcross, I want to bring up the vaccine and what you guys are seeing over there in New York and just your perspective as a doctor when it comes to the Pfizer vaccine, the Moderna one, the AstraZeneca one. Is there a difference in how it impacts minorities?
Well, look, I wouldn't say there's necessarily a difference in how the vaccine itself necessarily impacts minorities. There definitely is an impact as to the adoption of wanting to take the vaccine. As we know, we have two at our disposal right now, the Pfizer and the Moderna. AstraZeneca just got approved in Europe and may be coming over here soon, and we have a couple more on the way. But I'll tell you, these studies have shown that the vaccine appears to be effective to 95% for the two that we have here, the Moderna and the Pfizer. But on the minority side of things, there's a lot of mistrust in the medical community, which is very deep-seated, especially in the African-American community with the Tuskegee experiment and things that were back in 1970. That's a real big deal, guys, and you'd be really surprised to understand that just keeps getting passed down from generation to generation.
How long ago was the Tuskegee experiment?
I want to say it was in 1970s, like 71.
It was earlier than that.
Yeah. Oh, no. I think
untreated syphilis. Is that what it was?
Exactly. They were injected. They were untreated for syphilis when penicillin became available. It wasn't offered to these subjects. Wow. And a lot of them died, and they were monitored to see what happened to people who were treated with syphilis. Well, they were untreated with syphilis.
Good Lord.
Yeah, and there's other horrible examples as well with OBGYN, a particular OBGYN who wouldn't give pain medications to African-American women.
What?
See how they responded to pain. I mean, a whole bunch of things.
That's Nazi-type stuff.
Yeah, unfortunately, and that's unfortunately a horrible history in medicine. So we got to win the trust of the people who really need this. Exactly. And so that's kind of my charge as well, to get out and talk about vitamin D. Let them know that there's websites where they can order their kit if they can't get into their doctors, that sort of thing, to make sure we're all on the same page.
Before we go, is there anything else, Dr. Redcross, you want to let our listeners know?
Yeah, so look, we talked about obviously the importance of vitamin D, the powerofd.org is a lot of information, but don't forget, you guys also touched on it. Exercise is incredibly important in addition to taking a deep breath every day. We're going through a lot, everyone, so let's take some time for ourselves and kind of come back together and get through this as a unit.
Definitely. On that good note, we'll end it there. Thank you so much, Dr. Redcross. We appreciate it. That is Dr. Redcross. He's the author of Bond, the 4 Cornerstones of a Lasting and Caring Relationship with Your Doctor. Our guest on 710 KURV.